This video is designed to help you understand the different approaches to conception available and help you choose the one that's right for you. Along the way, we'll answer some of the most common questions, but don't hesitate to ask your doctor about anything that concerns you. Sex education classes are probably a dim, maybe even embarrassing memory for most of us, and creating babies is far more complicated than your sex education teacher likely led you to believe. But like we said before, education is your key to successful conception. Knowing the details of the reproductive systems will make it easier to understand how you and your doctors can do the utmost to help you conceive naturally or with the help of science. The female reproductive system is made up of many parts. Chief amongst these are the ovaries.
A woman is born with all the eggs she will ever produce. They're stored in her 2 ovaries. At the time of ovulation, which occurs each month about 14 days before the onset of menstrual bleeding, 1 ovary matures an egg or ovum.
Now that we have an idea of how to best prepare for pregnancy, we can address the many causes of infertility that affect people of all walks of life. The possible causes of infertility are numerous. We can explain some of the more common issues like tubal damage or disease, polycystic ovary syndrome or PCOS, uterine abnormalities, hormone imbalances, endometriosis, age, male infertility, and unexplained infertility.
IUI is a relatively simple procedure that involves passing a fine, soft, flexible catheter through the woman's vagina and cervix into her uterus. This process might require fertility drugs or may be done without medication. IUI can be done with your partner's sperm or with commercially purchased donor sperm.
As with many medical treatments, there can be side effects, and you should be aware of them. Most women who take fertility pills do not report side effects, but those who do may have headaches, hot flashes, breast tenderness, visual disturbances, abdominal discomfort, and nausea. The main risk of treatment with fertility pills is the risk of a multiple pregnancy. If fertility pills are not effective, injections of gonadotropins may be necessary.
The embryos that are to be transferred are drawn up into a catheter attached to a syringe. The catheter is given to a physician who inserts the catheter into the uterus and injects the embryos guided by an ultrasound.
On the same day, the embryos that are suitable for freezing will be frozen if you desire. Embryos are placed in a freezing solution to protect them from the freezing and thawing processes. They are then placed into a freezing chamber, and the temperature is gradually reduced to -200 degrees Celsius.
Canadian law prohibits the commercialization of egg donation, including payment to the donor, the purchase of eggs in exchange for property or services, and the advertisement of these services. So obviously, finding someone who will do this for you for compassionate reasons can be very difficult for many couples. Fertility treatment can challenge your expectations and patience. A clear head and an awareness of the many curves that can appear on any attempt at fertility is one of your best tools in trying to become pregnant.
Just remember to confer with your doctor, family, and any partner you might have. Ask for the help and support you'll need on this journey. I hope we started you off by getting you closer to choosing the approach that's right for you.